And welcome, ladies and gentlemen, to this very special segment on this Friday. Yes, Friday the 13th, whatever you might call it. Yes, it is that Friday. Right now here in Brisbane, it is 22 degrees and it will get to a maximum of 23 degrees today. It's going to be a beautiful, beautiful day out there. And as I look out the window, it's just amazing. And of course, it's going to remain sunny. And there's lots of things that is going to be happening in the weekend. We'll talk about that. But it's Friday. It's Black Friday. If you call it that way, it is the Friday, the 13th of August. Well, let's get on with the show and see what we're going to be talking about. Well, all of a sudden, ICT has come into the scene with their snap lockdown. Let's see what's actually happening there.
Facing the media to make an announcement Canberrans have been dreading.
This is the most serious public health risk that we have faced in the Territory this year, and really since the beginning of the pandemic.
A positive case prompting Andrew Barr to declare a snap 7-day lockdown.
This is the best path to pursue, to protect the health of the community and to avoid even more damaging and prolonged lockdowns and more significant economic consequences.
The first case, a man in his 20s from Gungahlin, who is believed to have been infectious in the community since Sunday. Fragments of the virus have also been detected in wastewater in northern and central Canberra and the Woden Valley. A long list of exposure sites has been identified, including a nightclub in Civic, a church in Woden, multiple retail stores in the Canberra Outlet Centre and a department store, as well as the Coles supermarket in Manuka. More than a dozen locations in total, with the possibility of more to come.
If you have been at any of these venues during the times listed, you must quarantine for 14 days. That is full quarantine, and you must get tested.
Then this evening, an additional 3 cases were confirmed, all close contacts of the first. Multiple other close contacts have already been identified, but authorities want to do all they can to stop the spread of the virus.
Of course, this will be discussed at National Cabinet today. I think from our point of view, from Queensland's point of view, we are very concerned, as I said yesterday, about how the clusters are continuing to expand. I think we would need to hear very clearly from New South Wales what their clear plan is for containment. The last thing we want to see is this virus spread north, the virus spread south and spread across the nation. So it's absolutely imperative that, that New South Wales contains this virus. We wish them all the very best. But of course, we still remain concerned, and we're looking forward to getting that update from New South Wales at National Cabinet later on this afternoon. So I'll hand over to Dr Young. Thank you.
Thank you, Premier. Yes, so excellent news. And the most important news is that those families are all gradually coming out of quarantine. And I just want to thank them. By the work they've done, they have actually saved lives. I can't say how many lives, but there is no doubt in my mind they have saved lives by what they've done. So we're now at 137 cases related to that Indooroopilly cluster. And one of those cases today is linked to St Aidan's Girls' School. So that was very important that all of those people were in quarantine. Thank you very much, the St Aidan's Anglican Girls' School community. And then the others were related to Ironside and to Brisbane Boys Grammar School, and there were test positives on day 10, 11 and 12. So we're still seeing those cases come through. But it's wonderful to see that all of those people can now come out and go about their normal lives. Those cases related to the 137 cases, unfortunately, of course, those families are going to have to continue to quarantine until it's 14 days since anyone in that household has had contact with a positive case. So I'm really sorry for those families. They're going to have to continue to persevere, but very, very grateful to them, because having had those 137 cases in quarantine during their infectious period meant we could control this outbreak and stop it spreading to the broader community. So it's been critical. And then no cases in Cairns, despite another day of enormous amounts of testing. So thank you very much to all those people in Cairns who have continued to keep coming forward. Please keep doing that, because we know that you can see cases continue to pop up. So it's really important. Just come forward and get tested if you have any symptoms at all. And then throughout the state, please, we don't know when a case will come up into our state from New South Wales. We saw how rapidly they've had an outbreak develop in the ACT. From one case, they've already got more cases. They've had a lot of positive notifications in their sewerage. So that's why we had to rapidly put in place those restrictions here for people who've been in the ACT. So anyone who's been in the ACT since the 9th of August, I'm asking that you immediately quarantine yourselves at home for 14 days from when you left the ACT, and as of 1 a.m. on Saturday, anyone who arrives will be required to go into hotel quarantine because there is a significant risk. The ACT was one of the last places in our country that people from Queensland could easily travel to and from. If you think we've had restrictions on other states, and other states have had restrictions on us. So really, I think there have been a lot of travellers going to the ACT. So I'd ask anyone who's been to the ACT in the last 2 weeks to just check our website for any exposure venues in the ACT and contact us if you've been to those exposure venues. And anyone who's been there since the 9th of August, please, it's really, really important that you stay home and quarantine. That's critical, and the slightest sign of a symptom that you get tested and do a day 12 test before you exit, and if you could do one as soon as possible, that would be really good.
So this is coming live from Queensland Parliament.
Thank you to all of the Queenslanders coming out and getting tested and also vaccinated. We're seeing an uptake not just at our Queensland health clinics but also at GPs, and now that we have more pharmacies opening up, we are seeing more opportunity for people to come forward and get vaccinated. So if you're not sure what's available in your local community, please jump online. You can check through the eligibility checker and also putting in your postcode and find out not just where your GPs are but also where your community pharmacies are and where the Queensland health clinics are across the state. So we want to see more people coming out and getting vaccinated. We're now at 23.07% have had their second dose across Queensland of eligible Queenslanders. We're seeing that number going up every day now, which is fantastic. I do want to just go through again, as Dr Young has, what restrictions are now in place for the ACT and also those 7 local government authorities across the border zone. So when it comes to the ACT, there are 3 groups that we need to talk to. First being anyone who is already in Queensland, who arrived before 5 p.m. yesterday, who has been in the ACT on or after the 9th of August. For those people, you must home quarantine immediately and remain in quarantine for 14 days since arriving in Queensland or since the 9th of August, whichever is shorter. The next group is anyone who arrived from 5 p.m. yesterday. You are all required to quarantine at home for 14 days. And the next group were those that arrive from 1 a.m. tomorrow, Saturday, the 14th of August. You will be required, if you are eligible to come into Queensland, so you have a border declaration that allows you to come, so you're a Queensland resident or you have an exemption to come into Queensland, you will have to go into hotel quarantine. So those are the 3 categories. In relation to the 7 local government authorities on the border, I just want to go through the essential workers. I know there's been a lot of discussion over the last 24 hours who can and can't come in and out of those 7 LGAs. So essential workers are medical practitioners, an emergency health services or emergency services worker, national defence, state security or police worker, a freight or logistics operator, an emergency infrastructure worker, emergency volunteer, disaster management worker, a critical infrastructure worker, a tradesperson or construction worker for essential or emergency construction or repairs only. Essential workers do not include teachers, anyone who can perform their work remotely at home, childcare workers, hospitality workers, sale representatives and commercial construction workers on non-critical projects. Can I just emphasise, I know there's been a bit of discussion about teachers and childcare workers because in the past they haven't necessarily been excluded from these movements. The reason why we have to exclude them in relation to these 7 LGAs, and it's only the 7 LGAs that New South Wales have put into lockdown, is because we cannot risk these teachers and childcare workers coming into Queensland, going into our schools and our daycare centres and risking spreading the virus. We've seen what this Indooroopilly cluster can do, and we've seen what having students infected can do. We are up to 137 people infected from our Indooroopilly cluster. So we can't take the risk of the virus getting into any of our schools. So we ask people to comply with those restrictions, and of course they're obliged by law to comply with the New South Wales lockdown restrictions anyway. Any other areas outside of those 7 LGAs that are in the border zone, the normal arrangements apply as far as travel and the border declarations. Last shout out, of course, is to our household home quarantine people who are still having to remain in quarantine. Thank you for the great work you're doing. I also want to give a shout out. I've been meeting lots of people, including at the Convention Centre the other day, who are supporting friends and family who are in home quarantine. And thank you for reaching out to them, for offering to walk their dogs, getting groceries for them. All the help you're doing means that these people can stay at home. So we're really grateful for that. And the last thing, I've been asked to give a bit of a call out. Our disposable masks, we're seeing a fair bit of littering of those disposable masks. So can we ask everyone to be responsible and dispose of your disposable mask in rubbish bins so they're not littered all over our streets and potentially going into our waterways as well? Thank you.
Live coverage coming all the way from the Convention Centre.
We've continued our enhanced focus on our road borders with New South Wales in the past 24 hours, and we've intercepted 6,381 vehicles during that period. 192 have been refused entry. No persons have had to go into quarantine, and only 2 breached the directions that required on-the-spot fines of $4,135 for each of those persons. So overall good compliance, but still a few too many people trying to get in that shouldn't. We're continuing to see an improvement.
So there you go, there are people trying to get in, the ones who shouldn't, and of course that puts a lot of pressure on the system itself. Well, we'll join that the news conference later on as well. But right now, as was mentioned in that about the ICT, and we began that before we crossed over to this live segment. So let's take a look at that report coming from ICT.
Facing the media to make an announcement Canberrans have been dreading.
This is the most serious public health risk that we have faced in the Territory this year, and really since the beginning of the pandemic.
A positive case prompting Andrew Barr to declare a snap 7-day lockdown.
This is the best path to pursue, to protect the health of the community and to avoid even more damaging and
we'll join now with the Premier.
And more.
I think New South Wales, very good question, Claire. Look, New South Wales needs to have a clear plan for containment. This is of serious concern to the rest of the nation. I'm very concerned about Queensland, which is why we've put in place those really strict restrictions of those LGAs, but we're seeing the virus creep north. It is a real concern. So what are the plans for containment?
You're talking about opening up bars for people who are vaccinated. Do you be suggesting that's not the way forward in New South Wales?
There's a national plan in place, and I would hope that New South Wales is part of that national plan. And that national plan is about 70 and 80% vaccination. But what we do have in New South Wales at the moment is a large outbreak. So I think we need to see as a nation the plans for that containment. Do you think it is safe? And can I just say too, look, this is very difficult for the families in New South Wales as well, and our hearts go out to them. And we do wish them all the very best. But we are seeing this is a contagious variant. It's spreading. It spreads easily. I've seen what's happened in places like Japan. I've seen how airports have been completely almost shut down, large international airports. This virus, once it takes hold, it's hard to stop. So what are the plans for containment?
Do you think, though, a statewide lockdown would be much clearer in terms of containment?
Well, I'm looking forward to hearing those plans today.
You would welcome that, though?
Sorry?
You would welcome the statewide lockdown?
Let's hear what they have to say first. But it's encroaching into regional parts of New South Wales. It's encroaching north. It's encroaching south. It's now in the ACT. This is really concerning.
In previous Queensland lockdowns, we saw play equipment chained up and beaches fenced off. Do you think New South Wales has been too lax with their lockdown?
Look, it's a matter for New South Wales, but it's now spreading from. It's not just in Sydney now. It's encroaching into other parts of the state. That is a real concern. Okay. Now it's up near the border, near where we are. It's of real concern.
The federal government effectively ruling out mandatory vaccinations this morning, doing the rounds on morning television. Should they reconsider that? Will you be raising that at National Cabinet?
Look, that is clearly an issue for the Morrison federal cabinet. When it comes to issues about mandatory vaccines, it is the federal government that should be sitting down with industry and unions. It is entirely a matter for them. I've heard some reports about being pushed out to the states. Let me say very clearly, the national vaccination program and whether or not they want to mandate certain sectors is a matter for the national government. They need to step up, and it's up for their national cabinet to make those decisions. It is not a matter for the states.
How much notice was given to teachers in schools in that border zone? Were some schools left in alert?
Question time.
Look, my understanding is that those conversations are happening, but we had a look at the data, and it's very limited. Very few teachers, very few childcare centres.
You said that the federal government needs to step up. Do you think they've been too slow in making a call on which workplaces should be made?
But it's a matter for them. So if industry has concerns and the unions have concerns, get them in a room, sit down, talk about these issues. But it's up to their federal cabinet to make those decisions. You can't just push it out to the states. It's not our responsibility. It's a federal issue. So I think the ball's in the Prime Minister's court here, with all due respect.
Clarify what non-critical construction means. I mean, a lot of people were trying to go to work this morning, might have gotten stopped at the border.
Oh, we'll get the definitions out to you. Yeah. Okay. Any other questions? Yep. Sure. Thank you. Thanks, everyone.
Could you talk on AstraZeneca update? So people in their 40s turning
Significant economic consequences.
The first case, a man in his 20s from Gungahlin, who is believed to have been infectious in the community since Sunday. Fragments of the virus have also been detected in wastewater in northern and central Canberra and the Woden Valley. A long list of exposure sites has been identified, including a nightclub in Civic, a church in Woden, multiple retail stores in the Canberra Outlet Centre and a department store, as well as the Coles supermarket in Manuka. More than a dozen locations in total, with the possibility of more to come.
If you have been at any of these venues during the times listed, you must quarantine for 14 days. That is full quarantine, and you must get tested.
Then this evening, an additional 3 cases were confirmed, all close contacts of the first. Multiple other close contacts have already been identified, but authorities want to do all they can to stop the spread of the virus. So, for the next 7 days, Canberrans are urged to remain at home except for essential purposes, including essential work, healthcare and essential groceries and supplies. Retail stores will be closed and it will be takeaway only at hospitality venues. Canberrans will be able to exercise outside for 1 hour per day and mask wearing will be mandatory.
There is no need for panic buying, and our key message to people is please be patient, be kind with one another and be thoughtful about the way that you respond to what will no doubt be a very difficult situation for many people in our community.
It's a plea that has fallen on deaf ears for some. Supermarkets across the capital were inundated by panicking shoppers, prompting some outlets to impose 2-pack per person limits on toilet paper.
What's it like inside, is it?
It's crazy. Meat, and that's probably going to go. The eggs are in high demand.
So as we know, the panic buying does come in, and we can't stop people because it's their mentality. Oh my God, we're going to be stuck and we might not have the things. But right now, Dr. Janet Young is answering some questions.
Ensure we vaccinate people.
I think it's really high school going back today. It is just for one day. Did you give any thought that perhaps it might have been safer just to give them a long weekend, or you're very content with them going back on a Friday? It's just obviously a time thing, but any thought given to that?
No, 14 days is 14 days, and it works every way you count it. So people needed to be in quarantine for 14 days. That ends, they can go about their normal lives. So no, I never considered that to ask the school to do something different. Otherwise, we'll get ourselves all tied up in knots. 14 days is 14 days.
If there's more cases over the weekend at those schools, is it going to look like they're going to have to shut down again?
There will be more cases, but they'll be in people who are in quarantine. So we still have those families where there's been a positive case, and I know we will get more cases, but they're the families that are staying in quarantine. So the message is very, very clear. If you've had one case in your household, you then need to work through with the public health people who will be contacting you and have spoken to you when you can then be released. And every single time another person in a household becomes positive, it's unfortunate, but that count starts all over again. So yes, there are some families there who are going to do it exceptionally tough.
Do you think it would help if New South Wales went into a statewide lockdown?
These are the sorts of things we're discussing every single day at AHPPC. If there's anything we can do to assist New South Wales, so we're working nationally so that we provide them additional contact tracing support, and we provide as much support as we can. So they're having those discussions in New South Wales, and I'm sure they will do what is the best thing that they need to do for their population.
Would it help Queensland though? Would it help Queensland particularly?
Well, we've already declared all of New South Wales a hotspot, and so we have our border zone which allows a little bit more movement, and where New South Wales is locked down within that border zone, we've tightened that. So we've got to remember all of New South Wales today is a hotspot for Queensland, including the ACT.
Given the rate of the spread in New South Wales, how likely do you think it is that COVID will spread into Queensland?
We are going to get more outbreaks in Queensland. I can't say whether they'll come out of New South Wales or if they'll come out of our international border, if they'll come out of those cases that they've clearly got in the ACT. They could come from anywhere, from Victoria. So we will see more cases in our community, so we need to be prepared for that, and we need to do, I'd love to find out how Cairns has done it, we need to do whatever Cairns did, because it's not spread up there. So we can manage this. It's really important. We just have to be less social with one another. This is not the time to hug people or to, give someone a kiss. It's time, except in your own household, of course. It's time to just try and maintain that bit of distance. Wear the masks, and you all know that as soon as I think there's a risk, I'll ask for masks. And when I think there isn't a risk, I'll say we don't need masks. But at the moment, we all need to wear masks.
Now, we had that ring of steel around it last year. Do you think that's something that New South Wales should be considering?
So New South Wales is managing their lockdowns. They're making sure people understand them. And I know that people in their regional parts, I've got relatives down there, hear them and they follow them.
What portion of Queensland's aged care workers for Queensland Health have had at least one vaccine, and how do you prepare to plan for a work shortage once that September deadline approaches?
It's reasonably good, but I'll get the media team to send out that specific data. I don't have it with me at the moment. But yes, we will work through with our aged care that they are all vaccinated. That's critical. There's no excuse.
Have any contingency plans on how to deal deal with the shortage once September comes around and they're no longer able to work?
Yeah, so it's 1 dose by September, and we're on track for that. And then it's a second dose after that. And I know hospital and health services have been working through those contingency plans.
Thanks everyone. So much,
So there are, ladies and gentlemen, that's the news coverage there from the convention centre or from Queensland government, and of course masks are here at the moment and they're here to stay for a while. So right now let's take a look at some of the functions and events taking place in the weekend. There you are, ladies and gentlemen, up to date on Australian Indian Radio, and it's Friday the 13th of August, and I hope that you have a good weekend. Well, of course, wishing everyone all the very best for India's Independence Day coming up on Sunday. And of course, we know that Sunday would have been the big India Day fair if it wasn't for the current restrictions in place. So it has now been shifted to 23rd of October. By that time, hopefully, we would be in a better situation restrictions-wise. So, the venue remains the same, which is the South Bank Piazza in South Bank Precinct, and of course from 10 a.m. till late the program. As the day comes closer, we will make that announcement. But on Sunday, Gopia Queensland is hosting a dinner for Independence Day Gala dinner at Queensland Parliament House. And I do apologize to many people who have missed out because of the COVID restrictions. They can only have that many number of people according to the square meter rule. So we are actually right on the limit of that, and we cannot take any more. We'd love to have you all there, but unfortunately, and it has been an overwhelming response, and I'd like to thank everyone who responded in a timely manner, and the whole event got planned, executed and sold out in less than 30 hours. The sales was in less than 22 hours as soon as the ticket booths opened, but the planning and everything was very quickly done with the help of Queensland Parliament. So in our first ever gala dinner for Independence Day by Gopio Queensland in Queensland Parliament House, we'll bring to you the updates from there probably on Monday. So on Sunday, there'll be live streaming of many Independence Day flag-raising ceremonies which will be happening locally, well, in Brisbane, in Canberra, and of course we'll also try and see if we can bring some of the other countries. The timing and the time zones makes it challenging. Otherwise, we will. Normally we don't, but this Sunday we will be broadcasting live to cover as many events as we can on Independence Day. So, ladies and gentlemen, until tomorrow, it's goodbye from me. It's been wonderful having your company. So good to see you as usual, and remain safe. Please follow those orders, the restrictions, and as we have seen that now ICT has been thrown into that lockdown as well. So, we can't get complacent, and we cannot just take things for granted. So, we need to take responsibility, and do our bit and try and stay put as much as we can. And that is very important. And of course, if you're ever feeling unwell or anything like that, don't go to any functions, don't go to work, just call in and say, I can't come today, or make some other alternative arrangements, but do not go to work and other places if you are unwell. So right now, it's once again goodbye from this segment. We'll see you all tomorrow with the Weekend Roundup, and on Sunday with some live coverage of as many of the flag raising ceremonies as we can get. So until then, it's goodbye from me.